Hi there, I'm Dr. Daryl Bossens with Barrie Chiropractic and Health Services Center. This video is going to show you how to do shoulder exercises. Now the video is meant to supplement an in-office discussion that we've had regarding specific shoulder exercises that we want you to do, likely for a rotator cuff injury that you might have. Alright, so you need to do these exercises with a TheraBand. The TheraBand that we would have provided for you is likely green. Perhaps you've got one of your own, but the green one is usually the one that we use for these types of exercises. Okay? So what you need to do is have this band and a door. We're gonna secure the TheraBand to a door, which makes it at about the right height so that you can do the exercises that we want you to do. All right? So what's going to happen then is you're going to take your TheraBand. As you can see, I've got a fancy connector on there, and you're probably not going to have that. You're probably just going to have two ends. You're going to just make a little bit of a loop here like this. You're going to open the door and you're going to secure that to the doorknob on the other side. Kind of like that. And then when you close the door, you'll see the end of that sticking out like that. And as you can see, it's not going to go anywhere. It keeps things pretty tight. Okay? So there's 5 exercises that we probably gave you a sheet with 5 exercises on it, diagrams of 5 different exercises. We may have given you at least 2 exercises, maybe 3. Maybe we've given all 5 of the exercises to you. So I'm going to show you all 5 of them in this video. If you have any questions about which ones we want you to do, make sure that you ask us. It's not a bad thing to do all 5 of them if you have an injury that requires these specific exercises. We might have only given you 1 to 3 as an effort to kind of work you up to them. So if you have any questions, make sure you ask us, okay? So the first exercise that we're going to do, you're going to, as I said, there's 5 exercises, but really there's only 3 because 2 of them are kind of the exact opposite of each other. And what's going to happen essentially is you're going to end up facing each of the 4 walls with each of these exercises. So the first one we're going to do, these are the 2 that we most commonly give people. With the band secured to the door, you're gonna wrap the band around your hand, sort of like that, so it's wrapped right around the meat part of your hand, and your thumb's gonna go up like that. Okay? So I'm gonna face that wall, and my elbow is gonna be at my side. So if you can move over here, so that you can see. So my elbow's gonna be at my side, just like that, and as you can see, the band's kind of slack right now, so the exercise that I'm going to be doing is I'm going to be pulling my hand across my body, and I want to make sure that I get resistance through that full range of motion. So I'm going to turn my hand outwards. Notice that my thumb's up in a hitchhiker position. The band is slack, so I'm going to step away from the wall in such a way that the band is now taut. Okay? That'll give me the resistance through the full range of motion that I want. Next thing you're going to do is you're going to kind of take a deep breath in a way. What you want to do is you want to lift your shoulder up, set it down and back. We call that setting the shoulder, okay? Once you do that, you just simply pull straight across the front of your body like that. Now, the cool thing about these exercises is that they work when you don't do them fast. So some people want to go really fast. You don't want to do that. The slower the better, because these are stabilizer muscles, and you want to make them work slow so they do a better job of stabilizing for you. So quite simply, band's wrapped around your hand, thumbs up, that's the way it's going to be for all of the exercises. Arm out at your side, elbow tucked in nice and tight, step away so you got some slack, set the shoulder, and pull it straight across nice and easy, okay? Alright, the next exercise you're going to do is we're going to face the opposite wall and essentially do the exact opposite of what we just did. So come on over to this side and I'll show you what I'm talking about. In this case, arms up, thumb in hitchhiker position just like we talked about, elbow at the side. This time what I'm going to be doing is I'm going to be pulling outwards, okay? So in order to get a full pull across that full range of motion, same thing, I want to set my arm inwards all the way. The band goes slack, I step out, take that slack out, and that'll give me the full resistance across this external rotation. So next thing you do, set the shoulder back and down and slowly pull that band out as far as you're comfortable. Let it in slowly and repeat. Generally speaking, we're asking you to do that anywhere from 5 to 10 times. Okay? Some people will pull that out and let it come back real quick. You don't want to do that. It's nice and controlled all the way out, back and forth. Alright? The next exercise that we typically give people, I'm going to unlock that for a second. Again, we're assuming that I'm working on my right shoulder for this video. So this one, you're going to This is an abduction or a side swipe type of exercise. You're gonna, again, it's my right shoulder, so I'm gonna put the band on the ground. I'm gonna step on it with my opposite foot. In this case, it's my left foot. I'm gonna wrap the band up just like I did, thumb in that hitchhiker position, only I'm facing forward. We want the band to be taut in front of my fly, essentially. So we don't want it to be slack like that. So I need to wrap it up enough times so that it's taut at my fly. I'm gonna stand up straight, my thumb's right in the middle of my body. I set that shoulder back, my elbow's gonna be bent like 3 degrees, just a little bit. And I'm gonna kind of push out to the side as if you're trying to stop somebody from getting around you. You're gonna kind of draw out to the side, and then you're gonna pull up. Notice where my thumb is, it's pointing straight forward like that. And you're gonna come up no higher than 90 degrees. Now for some of you, we might ask you only to go 45 degrees, but in general you don't want to exceed 90 degrees with this exercise. So really slow from this position, you're kind of pushing out and up and down, okay? So those are the 3 most common ones we'll give you. And I'll go back to putting my band inside the door here and show you the last 2 that we give people. Okay, so like I said, these exercises are going to be facing all 4 walls. So the first one we face that wall, the second one we face this wall. I just showed you the one where you're not tied into the door. Now I'm going to face this wall. Again, we're working on my right shoulder. I'm going to wrap it up just like we talked about before, thumb facing forward. Now this time I'm going to put my arm out at about 45 degrees, my thumb's forward. I'm going to step back so that the band gets taut. And all I'm going to do is swing my arm at my shoulder straight back as far as I can go, which equates to about, what is that, 30 degrees or so. Nice and slow, back and forth. So the action with this is that it's at my shoulder. Some people will do this with their elbow, and if you feel the muscle working in your tricep, which is right in here, you're doing it wrong. You should feel it right on the shoulder blade. You should feel that muscle working right on the shoulder blade, okay? And the last exercise, you're gonna rotate around and face our final wall. So in this case, I need to get you to come over here. In this case, I got the band wrapped around my hand again, and there's that thumb up position facing forward. This time I'm going to step forward so that my arm's back in a comfortable extended position somewhere around 30 degrees or so. And I've stepped away from the wall so that the band again is slack, and I'm going to swing my shoulder. I'm basically going to need to concentrate on trying to use the muscles in the front of my shoulder to pull that forward. Okay, just like that, nice and slow. And I only need to go about 30 to 45 degrees forward like that. This is going to work the anterior part of the shoulder, the bicep tendon, which sometimes gets kind of strangulated within that capsule of the shoulder when there's a problem. Okay, so that's how that works. So you've got 5 exercises, 4 of which are facing walls. First wall, you're pulling in. That wall, you're pushing forward. This wall, you're pushing out. And then this wall where you're pulling back. And the third one, or the fifth one where you're pulling out that way, okay? If you have any questions at all or any difficulties, make sure you talk to your doctor or give us a call at 705-792-6690. Good luck.